8 things every woman should know about varicose veins. Do you absolutely despise shorts weather because you've got unsightly leg veins? We feel you, for real. Vein issues are some of the most common chronic conditions in North America. Luckily, armed with the right intel, you can learn how to prevent them, live with them, and even get rid of them. Here's what you need to know. 1. Varicose veins are caused by weak valves. First, a quick science lesson. Arteries and capillaries deliver oxygen-rich blood from your heart to the rest of your body, while veins return the blood back to your heart. Here's the rub: the veins in your legs have to work harder to do this since they are pumping against gravity. Valves are designed to be one-way only, but if the valves are weak or get damaged, they let blood flow backwards and pool in your veins, creating the bulge you see in varicose veins. 2. Heredity is the largest risk factor. While there are many factors that can increase your chance of getting varicose veins, genetics is numero uno. Thanks, Mom, explains Jeffrey G. Carr, MD, Medical Director of the Vein Center of East Texas. It is by far a genetic problem, with more than 70 to 80% of patients with varicose veins having a relative with varicose veins. Other risk factors include being a woman, sweet, obesity, aging, and pregnancy. That's because you produce up to 50% more blood to support the fetus. 3. Varicose veins don't just pop up in your legs. While varicose veins are most commonly seen in the legs due to the natural pressure of body weight and gravity, different forms of varicose veins can be seen in other parts of the body. Telangiectasias and venomylaces are common on the face and neck, while spider veins can be found on various parts of the body. Even hemorrhoids, enlarged veins around the anus, are a type of varicose vein. All of these concerns are caused by pooling of blood in defective veins, says Jennifer Watson, MD, of Spectrum Health Medical Group Vein Center. 4. Lifestyle changes can slash your risk. There are many risk factors that are out of your control, but you can do your part to decrease your chance of varicose veins by maintaining a healthy weight and avoiding prolonged periods of standing or sitting. Experts also recommend avoiding clothes that feel tight on your waist or upper thighs and wearing high heels for long periods, both of which can impact adequate circulation. So basically, you just got a pass to rock those yoga pants and Birkenstocks. 5. Varicose veins can be a cosmetic issue, a health issue, or both. Though some might be bothered just by the appearance of varicose veins, others may actually feel discomfort. The main symptoms are heaviness, aching, tightness, fatigue, tiredness, swelling and often itching, burning, numbness, cramping, and restless legs, says Carr. Not all varicose veins require treatment, but you should definitely see a doctor if your veins have become swollen and tender, have created sores on your skin, were interfering with your daily activities, or if one begins to bleed. Left untreated and ignored over time, there can be marked skin changes in the legs and poor vascular health that can lead to non-healing ulcers or wounds and even blood clots, says Carr. 6. You can fake a fix. If your veins aren't painful or impacting your daily activities, you can minimize the appearance of them by keeping your feet elevated when possible, using self-tanners to decrease the difference between your leg color and the vein color, or using a body-suitable concealer like Makeup Forever Full Cover Concealer, $34, Sephora.com, to neutralize discoloration. 7. You have many treatment options. Though vein stripping, the surgical removal of varicose veins performed under general or local anesthesia, was once the norm, newer non-surgical treatments have become more popular. There are a few technical differences among the techniques, but in general, They are all effective in permanently closing the abnormal, diseased veins that are causing the problems, says Carr. The most common techniques are heat-based treatments where either radiofrequency energy or laser energy is used to seal off and destroy the vein, which will dissolve into your body over time. The latest technique is venous seal, which uses an innovative medical-grade superglue to shut the damaged vein. Venous seal closure has some additional benefits as it does not require large volumes of numbing medication, allows for a single needle entry, and most patients do not require post-operative compression, says Watson. In addition to reducing the chances of a nerve injury, multiple veins can be treated at the same time. 8. If you've had one, you're likely to have more. Sorry to be the bearer of bad news. Having a faulty vein in one location does put the patient at risk for developing venous disease in other location, says Watson, and venous regrowth is possible. That's right, while most treatments are effective at destroying a damaged vein, they can regrow. Ready to get help for your varicose veins? Start by contacting your primary care physician, who may recommend you head to a fibulist, vein specialist, a vascular surgeon, or a dermatologist, depending on the type of treatment you need. Also, be sure to check with your insurance to see which types of specialists or treatments they might cover. Oftentimes insurance may cover some forms of treatments if your veins cause pain.